Hey guys, real quick, before the video starts, I did it again where I forgot to do the disclaimer when I filmed the video. So just like last time, not a medical professional. Take everything I say with a grain of salt. I am just here expressing my experiences. I'm not advising anybody else on what to do. I'm not giving medical advice or anything. So yeah, just throwing that out there, not a medical professional, just telling my story and just take what I say with a grain of salt. Hey guys, so today I wanted to talk a little bit about thrush. So yes, I had said last time that I was going to be talking about my experiences with Candida and thrush specifically. And so I wanted to start that today. I'm not sure if this is going to end up being like a two-parter. It might, depending on how long this video takes. So yeah, we're just going to kind of start talking and then just kind of see where it ends up at this point. So my journey with Candida. So it started back in March. And I don't have my calendar in front of me right now, like it's still inside, and I didn't bring it out because I just didn't think about it. But yes, so it started back in March when I took 3 antibiotics. So I took the antibiotic Bactrim twice. I did 2 rounds of it back to back. And then right after that, I took azithromycin. And I'm not exactly sure if one of them ended up causing the thrush over the other one, or if it was just a combination, or if it was just the fact that I took 3, I took it 3 times back to back. But after that point, I developed thrush for the first time, and I didn't know what it was at first. It just, my throat hurt really bad. And so I went to urgent care, and I just mentioned to them it might be thrush because I do have asthma and I do take a steroid inhaler twice a day. And I know that that's like a thing that can happen with people that have asthma. It's like a risk or whatever that you can get thrush. So I, mentioned that to the urgent care provider, and she said, well, now that you mention it, I do kind of see a little bit of white back there. So she was like, I'm gonna go ahead and give you some nystatin. So she gave me nystatin, and she only gave me a 5-day supply. So I took it, 7-day supply. So I took it for 7 days, and I noticed it coming back. And so I went ahead and refilled because there was like 1 refill on it. So I went ahead and did the refill and took it for 7 more days. And at that point, it seemed like for a couple days, and I have this all written down on a calendar that I can show the doctors when I finally do get in to see the infectious disease doctor. I do plan on bringing my calendar. I'm sure I'm going to look like very thorough. I don't know how many people go in there with a wall calendar, but I have one, and it has all the days in between and what medicines I was on and everything. So yeah, so there was a few days went by, maybe like a week, and then I noticed the feeling again, and I had gone in to see my pulmonologist for my asthma, and I mentioned to him, hey, I have the feeling again, but look, I had thrush, during this time, and they gave me nystatin. Do you think you could help me out here? What do I do? And so he prescribed me fluconazole, and he only gave me 7-day supply of fluconazole. So I took that for 7 days, and he advised me to eat food after I did my inhaler. And so I started that. He said that would prevent the thrush. So I started doing that. And it did not prevent the thrush from coming back after 7 days. I lasted probably about a week and a half, maybe a little longer than that. And then I got thrush again. And so at that point, I went back to urgent care, and I think that was the point that they decided to give me 2 weeks worth of fluconazole and said, let's knock this out. And so I took 2 weeks of fluconazole, continued to eat after doing my inhaler. And after I finished the fluconazole that time, I think it was about maybe 6 days or so, 7 days, and it came back. So I was like, okay, eating after my inhaler is not working. I don't know. I can kind of understand where he's coming from with that, as far as like pushing the medicine down your throat. But the problem is the thrush that I was getting was not in my mouth, it was in my throat. And so it's like it was already in my throat, and I was using a spacer already because, you know, when I went to other places online and asked other people that have asthma, like, how do you prevent thrush? A lot of them said, well, use a spacer. Well, okay, I was already using a spacer. And so the spacer, my theory about it, I've worked up some theories here because I'm not getting any answers from doctors. So my theory here is that the spacer was carrying the medicine back into my throat. It was bypassing my mouth, shooting right back into my throat, which was giving me the thrush in the throat. And then nobody was able to see it because I kept getting thrush like constantly. Every time I would finish a round of nystatin or fluconazole, I would get thrush again in a few days to a week, somewhere around there. And so I think what was happening was it was like shooting that medicine back into my throat, and then people weren't seeing it. I'm really lucky that they were just taking my word for it and giving me those antifungals, because the antifungals were working. Like, while I was on them, I didn't have the throat pain. I didn't have any of my symptoms. And so, but people were not really believing me, doctors, because they would look in my mouth, look in my throat, and they didn't see anything. And so at some point there, I decided I'm just going to stop using a spacer, because I didn't use a spacer all last year. Like, I got diagnosed with asthma in like April of 2023. And for that whole, like, however many months it was until December, from April to December of that year, I didn't use a spacer at all. So, and I was fine, and I never got thrush, and I was breathing perfectly fine. And it wasn't until I started using my spacer that I noticed, like, I had more trouble breathing. Like, my asthma was not under control, which is the opposite of what everyone says. But I don't know, I'm just the opposite, I guess. But so I started not using my spacer here recently, and the last time I had thrush, I actually got spots, like, in my mouth this time, because the medicine is staying in your mouth partially. So the good thing about that, it's bad that I still got thrush, but I was getting thrush anyway, even with the spacer. But the good thing about not using the spacer is that now I had the proof. You could see it in my mouth. And so what happened, first of all, so with my asthma, I was also trying new inhalers, because I had switched from my pulmonologist to my allergist to kind of deal with my asthma. And so she had tried me on a few different inhalers, and one of them, this is another reason why I have a hard time believing doctors sometimes, and I feel like I have experienced medical gaslighting, is, so one of the inhalers I tried was Trelegy, and that one I ended up having excruciating, crippling joint pain in my fingers and like my hands. And nobody believed me. They believed me that I had the pain, but they didn't believe me that it was coming from the Trelegy. Even though if you read the insert on the Trelegy, you read the insert that comes with it, and it tells you, it lists all the side effects, everything bad that can happen, and it lists joint pain. And when you go online to the Trelegy website, and not only the Trelegy website for like patients, but the Trelegy website that's specifically for professionals and like providers, it says joint pain is a common side effect. And so, you know, I was like, okay, this is a side effect of this. I need to stop taking it. So I told my doctors, and every medical professional that I told did not believe me that it was a side effect of Trelegy. Even when I told them, you can look it up, you can go online, you can see, you can talk to the manufacturer. it is a side effect. And every pharmacist that I talked to was like, no, it's not. It's not a side effect. I even went to the ER. I went to the ER for something that was unrelated, but I just mentioned my joint pain that just happened and that I was on Trelegy, and even the ER provider looked at me and said, "No, that's not a side effect." Excuse me? So then it made me feel like I was crazy. Like, yeah, so that's a side topic there, but that just kind of shows you why I have a hard time believing doctors at this point, and medical professionals, and why I have lost hope in the medical industry. So let's see, what's next? Oh yes, and then nystatin. So I was on fluconazole for a lot, and when I started getting thrush again after getting off of Trelegy and back on my inhaler that I'm on right now, Symbicort, I got thrush again. And so I, told my allergist about it, and I said, "Hey, can I get some more fluconazole?" And she said, "No, I'd rather do nystatin." The problem with nystatin though, okay, so the fluconazole interacts, here's the thing. It interacts with the antipsychotic medication I'm taking. I think I brought this up last time in the last video, that it increases it by twofold. So clotrimazole is another one that they like to prescribe, and that one increases the antipsychotic by sixfold. And so the only one that does not really interact with any of my other medications is nystatin. Unfortunately, as of right now, and it's been like this for a while, for a few months. I don't know exactly when it started, but there is a nationwide shortage here in the US for nystatin. And so I was lucky enough recently to be able to find a local pharmacy that had nystatin in stock. And so I was able to have my allergist prescribe me nystatin, and luckily I had her prescribe me the nystatin before I went to the ENT. Because here's the thing, so this is what happens. I do have a pretty good relationship with my allergist. She seems to be the only doctor, her and my primary care provider, that actually seem to believe me. Now, she is a little wary about it. She has told me in the past, "I don't want to be treating your anxiety. So we need to kind of figure out, do you really have a problem," before she will give me something or change something. But other than that, she's been pretty good with believing me and listening to me. So this last time that I had thrush, I had noticed the pain in my throat once again, and I knew I had an ENT appointment coming up. So what I did is I contacted my allergist and I said, "Hey, just a heads up, I think I have thrush again. I am going to be seeing my ENT, but do you think that you could maybe prescribe me some nystatin? I found some at this local pharmacy. Do you think you could prescribe me some nystatin just so I can have it over the weekend, and then I'm going to see my ENT?" Oh, no, I saw the ENT first. Whatever, point was I gave her a heads up. And so she said, "Yes, that's fine." So I told her just stand by or whatever. And so then I went to the ENT, and I had white all in my mouth. And no, I don't want to show you guys a picture. I was gonna say I'm gonna insert a picture here. I'm not. Sorry. I don't want to make you guys have to witness that. It's disgusting. But anyway, so I had the white spots in my mouth. I had the white stuff on my tongue, and I went to the ENT. I took pictures of it, so I had like proof, and I sent them to my allergist also. And she looked at them and she said, "I don't think it's thrush, but it could be strep. So definitely bring it up to your ENT." Okay. So I went to the ENT. I had him look in my mouth, in my throat, and I showed him the pictures. So he looked in my mouth and he said, "That's not thrush. If you had thrush, it would be all over your mouth." And he went on to Google, which first of all, they tell you not to go to Google, but then he went on to Google on his phone and pulled up a picture of somebody who had the most severe thrush that I have ever seen, just coated, white, coated, solid, hard plaque looking stuff just covering their tongue and their mouth. And he said, your mouth would look like this if you had thrush. And my thoughts are, why would you want somebody's mouth to get to that point before you diagnose and treat them? That's the problem I have with that statement. And so I said, oh, okay, well, what do you think it is then? Because my throat hurts really bad and I have these white spots. And he said, well, I think the white spots are just food. And I was like, okay, so what about the sore throat? He said, well, that's just acid reflux. And I was like, okay, but it doesn't feel like acid reflux. I've had acid reflux before. I take medication for acid reflux. So this feels like a sore throat, like when you're sick, it's like a sore throat. And he said, yeah, acid reflux can do that. And then he was very dismissive. Then he just wanted me out of his office. And so then after leaving his office, I told my mom, I said, hey, I want to stop at urgent care and see if they can, I want a second opinion, basically. And so I stopped at urgent care, the same urgent care that I had been going to, and I saw a provider there, and I showed her the picture, and I asked her to please look in my mouth, and she looked in my mouth and my throat, and she said, oh yes, I definitely see white spots in there. And she was like, it's some kind of an infection. She was like, I don't know, it could be thrush, it could be strep, we don't know, but it's definitely an infection in there. I said, thank you. At least she's not telling me it's food. And so she swabbed. I asked, can you please swab for thrush also? Because usually when they swab, it's just for like all the bacterias, like it'll tell you if you have any bacteria. And I was like, can you please include like fungus on there too? And she said, yes, sure, of course. And so she swabbed for everything, and then it was going to be a few days, so I waited for like 2 days, and yeah, so like 2 days, I think it was 2 days, 2 or 3 days later, the results came back, and sure enough, it was Candida, which I already knew. But now I have the proof, and so I screenshotted it on the app, and I sent the picture to my allergist, which she did not really answer me back. All she said was, go ahead and take the nystatin, because she had called in some nystatin for me ahead of time and just told me, don't take it until I know for sure if that's what it is. And I listened. I'm a good girl. I'm not going to go against, whatever. And so I was trustworthy and I waited. But so then I started taking it. She said, go ahead and start taking it. But she didn't say a whole lot. She didn't say like, oh, I'm sorry, I didn't believe you, or nothing like that. Of course not. Of course not. So I started taking the nystatin, and then that's the point. After having experienced that, and I had multiple doctors look in my mouth also before going to the ENT as well, before I started having like the really noticeable white spots. It was just white on my tongue, and I asked them to please look, and I had my pulmonologist look and I had my allergist look. Both of them looked and said, I don't see anything. Okay, so after all of this, I kind of gave up on medical professionals. And so what I decided to do during my 2-week course of nystatin, which did end up getting extended to 3 weeks, because I had asked my allergist if we could please do it a little longer, because people online had had success with doing nystatin or fluconazole for like 3 to 4 weeks, and they had had success doing that. So I was like, okay, I don't, if we're not going to do 4 weeks, can we at least do 3 weeks? And she said, yes, that's fine. I'll add an extra week. And so I was able to refill that prescription and continue for a week. But anyway, in the meantime, what I started to do is I started to do research and take matters into my own hands. So I researched what are some antifungal foods, because adding foods is probably the safest thing that you can do. I do believe in like adding herbs and stuff, but I know that some herbs can interact with certain medications, and so can foods. But foods generally tend to be pretty safe. So I looked up what foods can I add that are antifungal, because let's try and do this the natural way as well as with medication, and especially if nobody's going to give me any more medication. If I can't get a hold of nystatin anymore and doctors don't really want to prescribe me fluconazole continually like this, then I need some alternatives. So the first thing I added to my diet is I started rinsing my mouth with apple cider vinegar diluted in water. So what it is it's 1 cup of water, so like 8 ounces of water, plus a teaspoon of apple cider vinegar. And you shake it up and you rinse your mouth with it and spit it out. You don't have to swallow it. I don't want to swallow it because apple cider vinegar, I had looked up, and it does interact with certain things. You're not really supposed to drink a whole lot of apple cider vinegar if you take diabetes medication, I think is what it is. And I do. I have diabetes, so I take diabetes medication. And yeah, so it interacts with that. I don't swallow it. I just swish it around in my mouth, gargle it, and spit it out. So I started doing that after I do my inhaler every day. And then I also added lemon juice with water. And that is a cup of water, so 8 ounces of water, plus the juice from half of a lemon, a fresh lemon. Not the bottle lemon juice. You want like an actual lemon, and cut it in half and squeeze half of it into a cup of water. And then mix it up, and then I would rinse my mouth with that. And it kind of hurt my teeth a little bit because that's not really good for your enamel to have a lot of citrus like that. But I would swish it around on my tongue, mostly try and not put it all over my teeth, but mostly on my tongue. And then I would swallow it, because you can swallow that one. And I would do that. So my routine started looking like I would do my inhaler. I would rinse my mouth, gargle with water, just regular water. I would brush my teeth. I bought a tongue scraper off Amazon, a metal tongue scraper. And so I started scraping my tongue. After I brushed my teeth, I would scrape my tongue with hot, like I would heat up the metal scraper. I don't know if that's a good thing or a bad thing, but I would heat it up with like hot water and then scrape it. And then I would rinse my mouth again, gargle. And then after I was done with that, I would go into the kitchen and take some apple cider vinegar, rinse it around in my mouth, spit it out, then take some lemon juice, rinse it around in my mouth, swallow it. But what I started doing, because even with nystatin and even with adding those things that I had added, I noticed my throat was still starting to kind of feel a little funny, and I still had a little bit of white on my tongue. So I decided to take somebody's advice on Reddit. I think had mentioned, I know Reddit is hit or miss with advice, but there are some people that know what they're talking about on there. So I decided to listen to one person's advice, and we'll see how it works. I'm still doing it, but they said to eat probiotic yogurt before doing the inhaler. So like take some spoonfuls of the probiotic yogurt, put it, make sure it's all over my mouth, and then swallow it and, eat it or whatever like you normally would. And then do the inhaler. Because in theory, again, it's not really, I'm sure there's not a lot of evidence based on it or whatever, but in theory, the medicine will then stick to the yogurt that's kind of coated your mouth. And then when you rinse your mouth and brush your teeth and all that, you're getting rid of it, instead of having it stick to like the tissues inside of your mouth or whatever. And so I started doing that as well. So I would eat yogurt, do my inhaler, brush my teeth, rinse with apple cider vinegar, rinse with lemon, and then that was it. I had also added a probiotic, and I wanted to tell you about the probiotic that I started taking. So it's called, I'm not going to say the brand because I'm not sponsored or anything like that, of course, but it's L-Reuteri Plus is the thing. So what it has is it has L-Reuteri, I hope I'm saying that right, I'm probably not, but it has lactobacillus, I don't know how to say these words, Lactobacillus reuteri, and it has Lactobacillus acidophilus and Lactobacillus rhamnosus. So it has those 3 in it. Now, from my research, the 2 that start with an R, the reuteri and the rhamnosus, are really good for yeast infections. So what I had read was like people, like there have been studies that have shown people with yeast infections taking those antibiotics and like those actually working for that. So I was like, okay, I definitely want a probiotic that has those 2 in it. And I was lucky to find this one that has both of those in it. And then it has that other one, I'm not entirely sure what it does, probably the same type of thing. But from my research, I was learning that your gut health has a lot to do with yeast all over your body. It kind of starts in your gut, is the problem. And that's why when you take antibiotics, even though you end up getting thrush in your mouth or in your other regions, it all starts with your gut. Like, you take the antibiotic and it destroys the bacteria in your gut. And so then your candida can go out of control and spread to other parts of your body. And that's kind of seems to be what happened with me, and what has happened to tons of people who also aren't getting a whole lot of help from the medical field. And so that's part of what I had added. So I had added a probiotic, then all the new antifungal stuff. And also I did more research on foods, and garlic apparently has antifungal properties. So I started cooking with garlic. Anytime I cook anything, spinach, chicken, even frozen fajita beef, like I like to cook or whatever, I just get the bag, the frozen bag at HEB or whatever, and I just cook the beef fajita meat on the skillet, and I started adding like chopped garlic or whatever, minced garlic. And I cook with garlic all the time now. So I've added garlic into my diet. And then I also read about sauerkraut can be a good like antifungal food. And so I started eating sauerkraut. And what I read is to take it like it's medicine. Like, just every day take a few bites of sauerkraut. So that's what I started doing. Luckily, I like sauerkraut, so it's not a bad thing for me. So those are kind of the things that I started doing, the steps I started taking. Oh, and I recently learned about toothpaste. So I'm not sure what the name is of the thing that is in the toothpaste. I am not prepared today, but there's an ingredient that's in most toothpastes, all the major ones at least. And it's something lauryl sulfate. I don't remember what it is, but basically if you Google that name and then you put thrush, everything comes up and tells you that it can increase your risk of getting thrush in your mouth, because what it does is it like destroys the inside of your mouth, basically. I don't know, the membranes or whatever. It does something, it aggravates your mouth, and so it can make thrush more likely to happen. And so I searched for a toothpaste that does not have that ingredient in it, and it was not terribly easy to find, but not as hard as I thought it would be to find. It's actually, I use Sensodyne because I have really sensitive teeth, and so luckily the Pronamel does not have that ingredient in it. So I just switched from regular Sensodyne to the Pronamel, and so we're gonna see, fingers crossed, that works for me. So yeah, those have been my steps that I have taken toward hopefully healing my body of the thrush, the candida that I have. And I did have a endoscopy done to check and see if I had candida in my esophagus. And she actually, and unfortunately this was during a time I thought I had had the symptoms again. It was after I had finished a round of fluconazole, and I thought I was getting symptoms again. So I made an appointment like immediately to have the endoscopy done. And I was like, okay, they're gonna find it, it's gonna be in there. And she went all the way down into my intestines or whatever, all the way, looked at everything, and came back and said there's no candida anywhere in there. So I was excited about that. I was like, okay. I was like, I don't know why I'm having this symptom, but you know what? The symptoms kind of went away after that. And I was like, okay, I guess it's fine. But then, of course, it came back, and we know the story. I just told it, that I had it in my mouth. And yeah, so I don't have candida. As far as I know, I don't have it down in my esophagus or anything. It just keeps coming back in my throat and my mouth. And I'm hoping that the probiotic and eating the yogurt and eating the sauerkraut, doing the apple cider vinegar rinse and the lemon rinse and all that, I'm hoping that all of that takes care of this. But if it doesn't, it doesn't. And this is just another journey that I'm on. So I'm trying to stay positive. I was very negative for a while there about it. I got super depressed. I mean, I've been battling this for like 6 months now. So I was super depressed for a long time about it. And now I've just kind of gotten to a point where I am taking my health into my own hands. And I actually feel better about that than relying solely on doctors. Because, like, throughout all of my health issues this past year, I have been relying on doctors. And what's been happening is I would panic because I would feel like I was dying, and I would just be begging anybody to help me, like any doctors, come on, anybody. I would go see a doctor, any one of my doctors, I would go see them and I would just be like, help, I need help. And they couldn't help me, or they wouldn't help me. And so now I've just kind of gotten to a point where I'm like, okay, I can't rely on anybody else. Nobody. I can't rely on anybody. So I'm going to rely on myself. And of course, I'm also praying. I'm also, trying to rely on God. But as far as like taking steps and doing actions, I'm having to make the decisions for myself at this point. And it's scary, but it's also makes me feel better knowing that, like, because I can trust myself to an extent, like more than I can trust anybody else, because I'm the one that feels it in my body, and I'm the only one that's really invested in myself. Anyway, I'm just going to end it there. If I have anything else to say about the thrush, the candida, anything about this, then I will make another video, or I'll probably include it in one of my other videos, like a little blip or something. So yes, I will talk to you guys next time. Thank you for watching. If you enjoyed the video, leave a like and leave me a comment, and just let me know if you've watched all the way to the end and if you got anything out of this video, or if you're going through the same thing, let me know about that too, because it's always good to know that there's other people that are right there with you. So yes, I will see you guys later. And next time, I'm not sure what exactly I'll be talking about, but I know I want to talk about more about my asthma, and I want to talk more about my MS and my allergies. So the asthma and allergies are probably going to go hand in hand, my issues with that. That is a whole other thing of not trusting doctors. So yes, anyway, so I hope that I helped you a little bit. And thank you for watching, and I will see you guys next time. Bye.